Hi, my name's Dr. Ross Hauser. Welcome to the Hauser Neck Center here in Fort Myers, Florida. I'm kind of laughing because I'm going to confess to you, I'm going to do a video on dry eyes and I'm actually not qualified to do it. So just hear me out before because the more I was thinking about this, like there's plenty of things that us prolotherapists see. Like even if we went back 30 years and we went to a prolotherapy conference in the 1990s, the doctors would be talking about, geez, somebody's breathing improved, their vision improved with prolotherapy. You know what I mean? Like it was always known that there would be these outliers, if you will, of, somebody had dry eyes, now they don't have dry eyes, or they'd have an autoimmune disease, then it seemed as though the prolotherapy somehow helped it get better, right? So I am not qualified to talk about use this medication for dry eyes, or somebody has Sjogren's disease and it's causing dry eyes. So I'm going to mention things like that. Like my expertise is in the neurology of the eye and how ligamentous cervical instability can screw up that neurology and can affect tear production basically in the eye. So just know, this video is not going to be about the medications for using dry eyes. It's just really about the ligamentous cervical instability etiology of dry eyes, and it definitely occurs. I would say in about a third of the patients that come to the Hauser Neck Center, they either have excessive tearing or they have dry eyes, which is a deficiency of tears. Because it's not normal to have extra lacrimal gland secretion of tears. Likewise, it's not normal to always feel like dry, burny, stingy eyes, right? And we're notorious in medicine, and I was just at the hospital because a very good friend of mine's wife's in the hospital, so I visited her pretty quickly. And we were talking about in the hospital about how almost everybody there is in suppressive, like in other words, they're there and the doctors are going to do a very good job of suppressing the symptoms, but are they doing a good job of stimulating repair of the organ, of the nervous system, of the tissues, so the person actually heals? Because if you don't heal the problem, like say somebody has, let's just go through this. So let's just say somebody has an autoimmune disease that's treatable, and let's just call it remission. Like in other words, you can get the autoimmune disease in remission if the person stops complaining, stops having a victim mentality, just decides to compliment everybody, never watches the news, just surrounds themselves with positivity, and then they do a hypoallergenic diet. So in other words, what they hear is only things that are encouraging and things that are true, things that are uplifting. They only watch on TV or the internet videos like what Dr. Hauser does because they're so true and they're so uplifting. But like positive things that have to do with healing. And so in other words, like say somebody does have Sjogren's and you take a medicine for like dry eyes or Sjogren's to suppress the immune system, the disease, whatever's causing the disease, is going to progress. Like things are progressive. Like if your teenage son isn't making the bed and you don't do something about them cleaning their room, the room just gets messier. The room's not going to get cleaner. So all these disorders are progressive. So we got to we at least got to try to get at the root cause. And I'm not saying ligamentous cervical instability in every person that gets positive and every person that eats healthy, their autoimmune is going to go into remission. But I had lots of patients when I would tell them these things and they would alter their diet, alter their behavior, start being, instead of melancholy, because basically I think of myself as a recovered melancholy. Like I used to be melancholy and introverted and people pleasing and scared of everything. Like No, doc, you're extroverted and you're really, really positive. Yeah, I did a lot of work. I did a lot of work in that. It took a while, but eventually I came to the other side. Like the person who constantly thinks of negative things, you're choosing to think of negative things. I was choosing, instead of looking at 20 patients I see and 18 are doing great, instead of me focusing on, I'm a good doctor, the two that weren't doing good, I would beat myself up, and I'm like the worst doctor. I'm supposed to be a world expert, and these people aren't getting better, and I'm awful, and I'm this and that. Like, that's not true. Then I would never compliment myself when somebody did really well, or I did a really good consult. Like, we got to get back to like, what's reality? Like, the reality is, I'm a good doctor. I am sure that you guys watching this, the vast majority of you are awesome, and if I could meet you, I would tell you how awesome you are. But you got to tell yourself, like, you got to look at yourself in the mirror. So when I was starting to do this, I mean, it was odd, but I would look at myself in the mirror and I'd say, I'm Ross Hauser, you're a good husband, because eventually you think like, oh, I'm a terrible husband. I'm a good boss, you know. Anybody who knows Sozo, I even did a Sozo session, you could research that. Because literally I did the Sozo session because I just, you know, I'm an awful boss, I'm an awful person, because the melancholiness just takes over. So the Sozo session, they just do their best, and there was 3 people there, and they do their best to try to get you to just basically imagine like you're gonna now go before God. Like they try to get you to, like you're trying to envision like you're going before God, and then you're literally trying to get your whole body, mind, and spirit there and try to listen to what God's telling you. And I didn't, and what I felt God was telling me then was I actually that was the very first time out of my mouth it said, I am a good boss and I am a good husband and I am, so it was just interesting, because people who didn't know that was going on inside of me would have had no idea, that I had these struggles. But I'm sure a lot of you have the struggles, because you go to doctors, then eventually some of them will tell you that your problem's in your head, like you got to take a chill pill. I'm going to give you some Xannies, that's what one of my staff calls Xanax, Xannies. They're going to give you Xanax, or Klonopin or something to help with your anxiety. It's like, who wouldn't have anxiety if I have these terrible symptoms and I go to doctors and they tell me nothing's wrong? Well, I'm telling you, it's likely your problem isn't in your head, it's not in your eyes. The problem is actually most likely in your neck, if you haven't been diagnosed with an autoimmune disease. Obviously, the patients that come to me with dry eyes or excessive tearing, it's people that typically are from the age of 20 to 50, and they don't have an autoimmune disease. Like, in other words, they don't know why their eyes are burning, or they're tearing excessively, or they're not tearing, or they have blurry vision, or their eyes are always itchy, or they have mast cell reactions. I just heard of a staff member that had a pretty bad mast cell reaction. And years ago, my wife was reminding me, we were on vacation with the staff member and their husband, and she had this crazy allergic reaction, which of course, you're going through poison oak, like you're hiking in the woods and everything, but it literally could have been a mast cell reaction at that. And I think what's happening with almost everybody who looks down at a cell phone, I think if we're all not honest and we're all not careful and we keep doing this, we're all on the progression to get all these things. So in other words, if you don't do anything, and especially if you're a gal and you're loose jointed, or you're a guy that's loose jointed, like you have extra flexibility than other people, if you're not careful and you start getting loose ligaments, instability in your neck, it's a progressive disorder, and down the pike is all this stuff. Dry eyes, nose problems, vision problems, stomach problems, swallowing problems, blood pressure problems, circulation problems, brain fog problems, cognitive decline. I mean, it goes on and on. Like, if you followed me around in the office and you weren't convinced, like, in other words, you're just watching this and you're not convinced any of this is true. If you followed me in the office, the patients I see, they don't have a cause of what's causing their problem. Many of them weren't in car accidents. They didn't have head traumas. All they know is one day they're doing relatively okay and the next day they have some symptom, and then from there it's almost like a neurocatastrophe. It's like almost every week there's something new and it's getting worse and it's getting worse. Well, dry eye syndrome, this is the fancy schmanz name, keratoconjunctivitis sicca. It's a lacrimal gland dysfunction. It means the lacrimal glands that, like in other words, there's times where, you have an emotional, like you see something terrible, or your friend is really, really sick and you see them and you cry, right? Like, so in other words, there's times where the way God made us, you're supposed to cry and get extra lacrimal gland secretions of fluid, but the tears, the lubricant in your tears, they lubricate the eye. They maintain nutrition and oxygenate ocular structures like the eyeball. It helps remove debris from the ocular surface and helps somewhat to help you see clearly. When you have dry eye syndrome, you get ocular burning, like a foreign body, like something's in your eye, stinging sensation, pain. You can get light sensitivity, blurred vision. It's basically the prevalence is about 15 to 20% over age 40. And interestingly to me is when you get Bell's palsy or you get a facial nerve palsy, you basically get dry eyes. So that's part of the clue that it may be, in many people, it's neurologic. It's neurologic. And if you follow Hauser's laws, and I would really recommend on Google you type in Hauser's laws and it'll take you to an article. And I'd really encourage anybody who follows me, please read that article. Because it goes through all the Hauser's law. Hauser's law number 2 is if you have a chronic disabling symptom or syndrome like dry eye syndrome or dry eyes, and nobody can figure out the cause, like there's no obvious cause, then if you follow the neurology is going to lead to ligamentous joint instability. Well, if you follow the neurology, okay, well, what's the neurology of the eyeball, the cornea, the lacrimal glands? You're going to see it involves 2 nerves, the trigeminal nerve and the facial nerve. So it's sort of like, well, what ligamentous joint instability could affect those 2? And you know where I'm going with this. It's likely going to be the neck, and it's probably going to be that your jugular veins are compressed because of the ligamentous cervical instability, and that's likely affecting, the brain stem and the facial nerve and the trigeminal nerve. So if you look at in traditional medical journals about dry eye syndrome, there's different when they look at the lacrimal glands, they have some inflammation in there, and so the medical treatments are normally to anti-inflame the lacrimal glands. And there's various tests. You can actually measure how much tears you're making. So obviously with dry eye syndrome, you're not making that many. Then they can test the fluid. And then you could see where here's the lacrimal gland, and that's what's going to give the film over your eye, right? Because, wind hits you. You don't want wind directly hitting your eye, right? So there's a film of tears, of lubricant, if you will, that's protecting your eye. And then if you don't have that, the wind, dust, all this stuff is gonna affect you a lot more. And this, I know this is a lot, but I would blow this up. But it says that ligamentous cervical instability can compress. It usually happens at the atlas here, and it compresses the jugular vein. You can get all these eye syndromes, dry eyes, it's right there, retinopathy, optic neuropathy. So if any of this applies to you, or you have retinal detachments, glaucoma, ocular hypertension, eye pain, cataracts, papilledema, I'd really encourage you to watch some of my other videos on the eye. And basically, if you look at all the various inflammation, like when they test people with dry eye syndrome, there's various things that occur in the lymph nodes, in the lacrimal glands, on the ocular surface, and the medications are designed to stop this. But again, it's like, why is it occurring? That's where you need a holistic provider. At least you need a holistic provider in conjunction with your traditional doctor if you decide to go the traditional doctor route. What makes me think that there's other things going on and not just dry eye syndrome in patients is, obviously I see a subset of the dry eye patients, but often people will tell me other things that make you think it is the neck, because they'll say, you know, I have dry eyes, or I've been diagnosed with dry eye syndrome, and it's like, when did that start? You know, let's say it started in 2018. Then I'll tell them, well, when's your neck pain start? Oh, doc, I know exactly when that started. You know, like I was working at my computer, I was working for this company. I think it was like 2016, or it was 2018, or it was around the same time. Like if you have dry eye syndrome or been diagnosed with it and you have clicking, popping, grinding in your neck, you know, it's likely that, you know, there is a connection. And also if you have the other signs and symptoms of ligamentous cervical instability, do you have light sensitivity? Do you have swallowing difficulties, blood pressure swings? Do you have clicking, popping, grinding in your neck? Do you have tachycardia? Have you been diagnosed with POTS? Is your autonomic nervous system kind of screwed up? Do you have digestive problems? You know, do you have tinnitus? So anyway, if you look at the neurology of the eye, basically, the neurology of the eye involves the trigeminal nerve. That's cranial nerve 5. Cranial nerve 7 exits the brainstem around here. So this is all the brainstem. It's very close to the upper cervical region. So if you got upper cervical instability, that can affect the trigeminal nerve. So the trigeminal nerve right here, the trigeminal nerve, has nerve cells that go all the way down to here. It's called the trigeminal cervical nucleus. So any sort of upper cervical problem can affect the trigeminal nerve. The trigeminal nerve gives sensation to the eye. So in other words, somebody can have the symptoms of dry eye syndrome, right? They have the symptoms, well, they have the symptoms of a dry eye or an irritated eye, but they're actually making the normal amount of tears, right? So technically that wouldn't fit this. So in other words, they have all the symptoms of dry eye syndrome, but the lacrimal gland's making enough tears. Like that would be the distinction. So you can have irritated cornea, you feel like there's a foreign body in there, that you need to rub your eyes a lot, they might burn. Like I get this probably once every 2 weeks. Like my eyes are totally fine, then I'm going home, you know, and it's often after I'm just exhausted. Like I'm exhausted from the office. I might have had several busy days in a row, and then at that point, what I think it is like my vagus is shot, like my vagus nerve is shot and my nervous system shot, and then I start having, you know, these kind of things. I mean, they don't last. Like obviously if they lasted in me, I'd probably go see Dr. Hauser in Fort Myers, you know, and get checked out. Here, so see the lacrimal gland here, that's what makes the tears, and see how it's part of the innervation is the trigeminal nerve, and part of is the facial nerve. It's actually the facial nerve. Well, the facial nerve actually, oh yeah, the facial nerve right here, it goes there. Yeah, it goes to the lacrimal gland, parasympathetic. So when that's stimulated, the facial nerve stimulated, you're going to get tears. The other thing too is the facial nerve runs pretty close to the atlas too. So when somebody has a forward head, face down lifestyle, they get ligamentous cervical instability because this lifestyle, it stretches the ligaments back here. That can lead to trigeminal nerve dysfunction, you know, lacrimal nerve injury, which is a branch of the trigeminal nerve. Then you get the sensation of dry eyes. You don't actually have dry eyes, but you get the sensation. That's what I was trying to explain. Then The ligamentous cervical instability can lead to compression of the jugular veins and injury to the vagus nerve. And then basically that can, through the greater petrosal nerve, that can get dysfunctional and you get poor eye lacrimal gland function. Or you can end up with leaky gut, which leads to an autoimmune disease. So even if somebody has Sjogren's, they may want to get their neck checked out. And if they work on the computer a lot or they're kind of addicted to the cell phone, you might want to get prism glasses, which have a mirror, or you have your computer up high, which I call the looking up lifestyle. Now, there are a lot of risk factors if somebody has dry eye disease, right? If they use the computer screen excessively, typically occurs more in females. Somebody might have migraine headaches, hormonal problems. They might be on anticholinergic medications that cause the tear production to go down. So there are other factors, but that's not normally the patient population that I see. It's normally, they're not on these medications. They're 20 to 50. They're not perimenopausal where the hormones are going down. So obviously I run the Hauser Neck Center, so the patients believe that it's likely coming from their neck. And there's a host of medical conditions that make one more prone to getting dry eye disease. So you've had your eye checked out, you went to a neurologist or an eye doctor who knows about the lacrimal gland, and they can't figure out what's causing it. I think somebody has to look at, well, maybe the things that are going on in the eye, maybe eye inflammation and different things, it's occurring because the neurology is off. And especially if somebody has other symptoms that show the neurology's off, right? There's pain, there's visual problems, there's tachycardia, the stomach's not working good, swallowing's not good, maybe pain down the arm, there's other neurologic things. So maybe the treatment should be neurologic and maybe not so much related to ophthalmology, even though I would recommend getting an ophthalmology eval. But again, a lot of times the treatment with the ophthalmologist or the rheumatologist is going to be anti-inflammatory or biologics that decrease the inflammatory component of dry eye disease, right? Where we would do dynamic digital radiography, a digital motion x-ray, like we would move the neck, we would look at, does the person have jugular vein compression? Like we would do ultrasounds in different neck positions. We'd also measure the vagus nerves. Are the vagus nerves affected? And obviously, usually the person has a list of symptoms and dry eyes or excessive tearing is just one of them. So it makes sense that maybe the dizziness, the tinnitus, the dry eyes, the neck pain, the head pressure, the brain fog, it all has a common etiology which relates to a breakdown of the cervical curve and ligamentous cervical instability. So the treatment is a looking up lifestyle, get your computers up, various exercises to restore your neck curve, and prolotherapy injections to thicken and tighten the ligaments if ligamentous cervical instability is present. And that's why I often say the looking up lifestyle is healthy and the looking down lifestyle, eventually it's going to cause some illness. So thank you guys so much. I hope this answered your questions in regard to the ligamentous joint instability etiology of potential etiology of dry eye disease.